So you've got diabetes, and surgery is on the horizon. That can feel a little daunting, right? But what if you had a clear roadmap for what to expect? Today, we're breaking down the essential guide for managing diabetes through surgery, turning the medical playbook into a simple, step-by-step plan.
If your loved one has diabetes and is looking at a surgical procedure, a ton of questions probably pop into your head. How is this going to affect my blood sugar, and what's the plan to keep me safe? Well, let's get right into those answers. Okay, this is the single most important thing to get right off the bat. Having diabetes doesn't automatically make surgery super risky. Nope, it just means that having a clear, coordinated plan is absolutely non-negotiable. And the great news? Medical teams have this whole process down to a science.
All right, first things first, let's dig into why surgery is such a unique challenge for your body's glucose control. It really all boils down to a totally natural, but super powerful biological response.
You see, the stress of an operation literally kicks your body into fight or flight mode. It unleashes this flood of hormones, like cortisol, and they do two things. First, they tell your liver to dump extra sugar into your system for energy. And second, they make your body more resistant to the insulin that's supposed to handle all that sugar. It's this one-two punch that we call stress hyperglycemia.
And listen, this isn't some rare thing. Stress hyperglycemia is incredibly common, affecting up to 40% of all patients going through general surgery. It can even pop up in people who've never ever been diagnosed with diabetes before. And for something like cardiac surgery, that number can climb even higher.
So you might be asking, why is the hospital team so laser-focused on this? Well, it's because high blood sugar isn't just a number on a screen. It has real-world consequences. We're talking about things like delayed wound healing, a higher risk of infection, and yeah, unfortunately, longer and more complicated hospital stays.
Okay, so to dodge all those potential problems, your medical team has a solid playbook, and it starts way before you ever set foot in an operating room. This whole pre-game prep really boils down to 3 key steps. First, your team's going to do a deep dive into your medical history. They want to know your specific type of diabetes, how well it's controlled, the whole picture. Next, they'll cook up a personalized plan for your medications. And finally, they'll give you super precise instructions on how to adjust your insulin doses leading up to the procedure.
So let's take a look at the game plan for some of the common medications. You'll notice every single adjustment is there for a very specific safety reason. Metformin? That's paused to prevent a rare but serious buildup of acid in your blood. Those SGLT2 inhibitors? They're stopped to avoid a tricky condition where your body produces high levels of acid, even if your blood sugar isn't high. The big takeaway here is that these are all temporary pauses, and it's all about keeping you safe when your body's under stress.
And what if you're on insulin? Well, the plan is just as precise. You're not going to just stop your long-acting or basal insulin cold turkey. No way. Instead, your team will most likely have you dial back the dose a bit, usually by about 20 to 25%. This is super important because it keeps a baseline level of insulin working in your system, but it also prevents your blood sugar from crashing when you're fasting before the procedure.
Okay, so let's move into the operating room itself. This is where that pre-op plan really pays off, and the monitoring gets even more intense.
The strategy in here is totally tailored to your specific surgery. For shorter procedures, less than 4 hours, the team will check your blood sugar every couple of hours. If it's high, they'll use a targeted injection of correctional insulin to bring it down. But for the longer, more complex surgeries, they'll often switch to a continuous IV insulin drip. This gives them amazing minute-to-minute control to keep your glucose levels right in that sweet spot, which is usually about 140 to 180 milligrams per deciliter.
All right, surgery's done. Now the plan shifts again. The new focus is all about managing your blood sugar safely while your body starts to heal and you get back to a more normal routine.
So in this recovery phase, the strategy really depends on your condition. For most patients who are recovering on a standard surgical floor, they'll be managed with what's called a subcutaneous insulin plan, basically injections under the skin. But for patients who are critically ill, say in the ICU, that continuous IV insulin drip is often kept going. Why? Because it offers the tightest, most responsive control when the body is under that level of extreme stress.
For pretty much everyone on those subcutaneous injections, modern care uses this really smart basal bolus approach. Think of it this way. The basal insulin is your foundation. It's working 24/7 in the background. The nutritional insulin is for your meals. It covers the carbs you eat. And then the correctional insulin is like your on-the-spot fix for any unexpectedly high readings. This 3-pronged system is just so much safer and way more effective than the old-school methods.
Now, this next point is absolutely crucial. A non-negotiable rule for anyone with type 1 diabetes: that basal insulin, that foundation, is never stopped. Ever. Because a person with type 1 doesn't produce their own insulin, that continuous supply is essential to prevent a really dangerous condition called diabetic ketoacidosis. And that's true even when you're not eating a single thing.
Okay, I know, managing all these moving parts might sound like a lot. But here's the key. You are never, ever doing this alone. It is a massive, highly coordinated team effort. You are literally at the center of this incredible team of specialists. You've got your surgeon, anesthesiologist, nurses, pharmacists. All of them are constantly communicating and working together. They're not just winging it. They're following standardized, evidence-based protocols to make sure your care is totally seamless and safe, from the second you walk in the door to the day you head home.
And that brings us to the final and really critical step: a safe discharge plan. Before you leave, that team is going to make sure you have crystal clear instructions for all your medications, that you know exactly how to get back into your home routine, and that you've got your follow-up appointments all set up. It's all about making that transition back to daily life as smooth and safe as possible.
So, after all that, what is the single most important thing you should take away? It's this: be an active member of your own care team. Seriously. The most powerful thing you can do is to ask your doctors and nurses one simple question: what is the specific plan for my diabetes before, during, and after my surgery? Understanding that plan, being a part of that conversation, that is your absolute best tool for a safe procedure and a smooth recovery.